Hey y'all, this is Rohit Verghese back again for week 6 of remediation. And so I have another 3 questions that I want to talk about today. And now the first question is as follows. The nurse provides care for a client who underwent a laparoscopic appendectomy less than 24 hours ago. The client reports abdominal fullness and pain unrelieved by pain medication. On assessment, the client's abdomen is distended and firm with hypoactive bowel sounds. Which nursing action is priority? And so I picked answer choice number 1, which was incorrect. It stated contact the healthcare provider. And so this is incorrect because what the nurse should actually do is ambulate the client to encourage gas relief. If the pain persists, then we should notify the healthcare provider. This means that the correct answer choice is answer choice number 2, ambulate the client. And this is correct because this is a priority intervention. The nurse should first ambulate the client to promote gas relief and stimulate gut motility. That's why answer choice number 2 is correct. Moving on to the second question, it goes as follows. The nurse prepares the plans of care for clients on the unit. Which task can the nurse safely delegate to an unlicensed assistive personnel, or UAP? Now, the answer that I picked was answer choice number 4, feed a client diagnosed with myasthenia gravis. Now, this is incorrect because the client is at risk for aspiration. And so the ongoing assessment that is required while the client is fed is not within the scope of practice of the UAP. It's within the scope of practice of a nurse. Now, the correct answer is answer choice number 2, provide a therapeutic back rub to a client with chronic pain. And so this is correct because a UAP can perform non-pharmacological comfort measures for stable clients. And so this is why answer choice 2 is correct. Moving on to the next question. Now, this is a special type of question. It's a arrange in order question, which I got all wrong. And so the question goes as follows. The client has a prescription for 1 unit of red blood cells, or RBCs. The transfusion begins at 0945. At 10:03, the client reports chills and back pain rated at 5 out of 10. The client's skin is flushed, BP is 98/66, and a pulse rate of 108. In which order does the nurse implement these nursing interventions? Now, the answer choice that I picked, the order that I picked was first, stop the blood transfusion, then begin 0.9% sodium chloride infusion, then assess blood pressure, heart rate, and respiratory rate, then obtain blood and urine specimens, then hang a new IV infusion set, and then the last step would be calling the healthcare provider. This was all out of order. The correct order is actually stop the blood transfusion, hang a new IV infusion set, begin the 0.9% sodium chloride infusion, then call the healthcare provider, then assess blood pressure, heart rate, and respiratory rate, and last but not least, obtain blood and urine specimens. And so this is the correct order because the client is showing signs and symptoms of a possible hemolytic reaction. And so the prioritization of actions that we need to look at is first stopping the blood transfusion and disconnecting the tubing for the IV cannula. The second one was to hang a new IV infusion set, and this would be needed so that no further blood is infused. And then step number 3 is starting the normal saline solution in order to promote perfusion and reduce potential kidney injury from the hemolytic reaction. The next step is to notify the healthcare provider. And a current set of vital signs is provided in the stem of the question, so there is no need to reassess prior to notification. You just go ahead and give it to the healthcare provider. The next is reassessment of vital signs and client symptoms, again after stopping the blood. And the last step was obtaining blood and urine specimens per facility policy for confirmation of hemolytic reaction, just to make sure that this client was facing a hemolytic reaction and not some other thing. And that was my 3 questions for this week. I hope you guys have a great day.